Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hello, this is Lucas, and I look after corporate healthcare at GPDQ, and we have our clinical director on with us today, Dr. Kathrina. We're going to talk about health checks today. As things have opened up, people may want to be a bit more proactive about their health, and in fact, we often get asked what health check is. So we've picked a mid-range check to talk you guys through it.
Thanks, Lucas. So yes, it's very important for us to be proactive about our health. And we often do get asked what are the different components and what each test is for. So I think it's a great opportunity just to talk through the health check and give a bit more information on each component.
Excellent. So without further ado, what is an average, a mid-range health check then?
Okay, so all health checks will have the basics. So you'll start off talking to your doctor and have a discussion between the doctor and the patient, and then some physical health checks, and then going on to some blood work, so some blood tests.
Great. And what is involved in the health history and the lifestyle assessment?
So that's probably the foundation of the assessment. It's very important to have a discussion, and in that discussion, we'll cover kind of any problems that you have with your health, be it if you're tired or lacking in energy, or any complaints that you have about your health. And then we'll go on to talk a little bit about your past, so your past medical history. And in that, it'll be as if you've ever been diagnosed with a condition. So perhaps you've had high cholesterol in the past or high blood pressure. When you've had your last health check, for example. And then following that, we can ask some other questions, like if you smoke, if you drink alcohol, if you exercise, how you're sleeping. So that's the basis and the foundation. And that also puts into context the rest of the examination, puts the context of the physical health checks and the blood tests. So kind of helps create a picture of what's going on. And it's quite an important part. It's probably one of the most important parts of the consultation.
Yeah, totally. And what physical health check do you typically do?
So physical health checks, we would do blood pressure, we would do weight, height, and BMI, and also we would do a urine test. So that would be the physical health points that we would do as a start.
Okay, yeah, that's quite clear. And would you be able to explain what sort of purpose the blood tests serve in the health check?
Definitely. So there's a number of different blood tests. And if I give you an example of some of the basic blood tests and what they do, and if there's any more specific ones that anyone has, I'm sure that they can contact GPDQ and just ask specifically. So we've picked out some of the most common ones. So cholesterol is a blood test, and it's essentially measuring the cholesterol, which is a type of fat produced in your body. Now, if it gets too high, it can increase your risk of heart disease. And there's no specific symptoms, or not symptoms that are easy to detect for high cholesterol. So that's why it's good to have a blood test and to measure it. Another test that we do is called HbA1c. Now, that is a test that we use to monitor sugar. The HbA1c is essentially a shot of it. It gives you an idea of how high your sugar has been in the last 3 months or so. And it's the test that we use to diagnose new diabetes and also to monitor diabetes. So when you get your results, it could either be normal, pre-diabetes, or diabetes. And that gives us a very good idea of how to take your health forward. And that, in combination with your cholesterol and your blood pressure and your weight, gives a great idea or a lot of information about your metabolic health and going forward your risk of cardiovascular health and stroke. So those ones together are quite an important group. We then go on. So another test that we do is the full blood count, or FBC, and that examines the different components of the blood. So it could show your red blood cells, your platelets, and your white ones. There's other factors as well included in that test, but that's the basic principles of the test, and that can show illnesses from anemia to infection, and actually even some forms of blood cancer. But the most common thing that we pick up is actually anemia. So if you're tired, that's one of the symptoms of anemia. Going on, the next one that we look at is something called ESR, and that's a test that we use to kind of diagnose symptoms associated with inflammation, and that could be kind of on the short-term inflammation or in the longer term. And one of the conditions that we pick up is like an autoimmune condition, but it can be a marker of various different things, so it has to be interpreted by a doctor. So there's a lot of information here.
I know, yeah, but useful to know, obviously.
The next test is the urea and electrolytes. That's a marker of kidney function. It can tell us how your kidney is doing kind of in the short term and in the long term overall. And it also kind of tells us if you're dehydrated, for example. The next test is the liver function test.
Yeah.
The liver's got a huge amount of, is a very important organ with lots of different functions. And essentially any alterations in the liver can show perhaps a fatty liver and many different conditions. So it's a very important test as well. Calcium is a marker of bone health. And lastly, thyroid function. So your thyroid gland produces hormones, and sometimes those hormones can be elevated or they can be depressed. And so I think people may have heard of an underactive or an overactive thyroid. And essentially that can give you symptoms of tiredness, affect your weight, sleep, mood. So it's very important to monitor. And if somebody's already got a condition involving the thyroid, we use this test to monitor how well they're doing on their treatments. So you can see there's many different tests. They have to be interpreted by a doctor. And so at the end of the consultation, with the results, the doctor would then call the patient back with the information that they'd gathered from all the three aspects. So the conversation at the beginning, the physical health checks, and also the blood work, and give a report back to the patient with recommendations.
Absolutely, and I guess again we're here being proactive about the health, because all of the things that you've mentioned can be treated, I guess, if anything was to be picked up. And you know, things like cholesterol and diabetes have been one of the main reasons why people struggled with COVID. So I guess that's another good purpose to look after yourself. So yeah, I am very positive that we've had lots of takeaways again today. So thank you once again for your time.
Thanks, Lucas.
Yeah, and thank you all for listening. Do tell your friends, and remember this week to put yourself and your health first.